Good morning, I'm Dr. Charafeddine. I'm with Dr. Labib, and we're going to talk about how at Eden we think outside the box when it comes to facial rejuvenation. We're going to tell you how we prepare our patients for their procedure and the importance of really looking into the cell to prepare the patient for the upcoming procedure. Dr. Labib and I will go over two cases today, okay? We're going to take two extremes to show you what we're talking about. I have a patient of mine a couple years ago. She had really a lot of swelling and a lot of discomfort after the procedure, and we couldn't understand why, because that same week we did a lot of cases and everybody did amazing except her, and she was like, Dr. C, I'm too swollen, and she wasn't comfortable, and she didn't have any wound healing issues, but there was something off about her. So Dr. Labib helped us, and he's going to tell you now what we found on her testing.
Yeah, I can't agree more with Dr. C about how people react differently to surgery, to injury, to trauma. So everybody's different genetically speaking. And when we talk about genetics, we're talking about the cellular level, how the cell reacts. So looking at the function of the cell, whether it's like the genes, the expression of their genes, how old the genes are, as well as what they produce as far as hormones, and what are the things that are affecting this, such as toxins or outside factors that we're exposed to on a single on a daily basis.
So for example, this patient. This is a patient who had a lot of swelling, a lot of discomfort after the procedure. And we find that she lives on a farm.
Yes.
And then Dr. Labib does a couple of tests for her. And what did you find?
So, yeah, if we're going to talk about this first patient, after the procedure, actually, I saw her after she had the procedure. So, and then, we did those testing. Her heavy metals, which includes aluminum, arsenic, mercury, nickel, all these were extremely high. And, of course, after digging into her history and where she lives, where she works, what she's exposed to from her water, from her food, even, the environment in the house, all of this, after we looked at it, we noticed that she has very high aluminum levels, high mercury levels, which, the sources of those can be from her water or from her food. And we try to work on lowering those heavy metals in order to help her healing process go faster and last her longer. So that's one, extreme case. We've seen, of course, people in between, but we also have another nice perfect case where all these heavy metals were extremely low. This patient takes care of her diet. She eats clean. She does yoga. She does sauna actually 2-3 times a week. And she's, tests her water at home. So therefore, all these heavy metals were extremely low. And this showed in the results of her procedure. And Dr. C can explain more about, the difference he saw in their, surgical planes and even the healing process of those patients.
So the second patient that Dr. Labib mentioned actually is in her early 50s. She's 53, but her genetic testing showed her she's at 44. And she had absolutely no exposure to toxins, and her hormone levels were actually very good, except some cortisol, right?
Right, exactly. So, but like if you think about it, the toxins were low, and this reflected in her genetic testing, or what we call the biological testing. So her age was 9 years less than what her chronological age is, and she was aging slower. And this was, a proof because her hormones were in, good balance, and her toxins were low.
Yep.
So it immediately reflected on everything in her head.
And when I went into her procedure, actually her tissues felt much younger, and the inside structures, this mass and the muscles, they all felt younger than her real age. And I expect her to get an absolutely fantastic result. And actually, she did get an absolutely fantastic result. She's just early now in the recovery period, and she's doing very well.